Hello friends, welcome to I Gurukul. Before going to start this today's session, I would like to request you all please subscribe my channel and hit the bell so that you will get all the notifications whenever I am uploading the new sessions on this platform. We'll have a quick revision on the anatomy of lens. So there is a question how we are able to see far and near objects. So for this we need to revise the anatomy and physiology of the crystalline lens. So where exactly the lens is located? The crystalline lens is located behind the iris and the pupil. Second question, how is the lens connected the ciliary muscles? That the answer is by the zonules. And the third question, what happens if the ciliary muscles contracts or relaxes? The answer is the zonules helps to change the shape of the lens to focus far and near objects. And the next one, what is the accommodation? This is the ability of the lens to focus far and near objects sharply. This process is known as accommodation. And the last question is, what is the mechanism, okay, for this process? When the ciliary muscles contract, the zonules loosen and the lens become thicker. So far, the focusing power of the lens is increases. So this is the just quick revision on the anatomy of lens. Coming to the presbyopia, quick we'll have a case that if suppose 47-year-old woman comes to you with the complaints of that she is unable to thread the needles and she is unable to identify the people on the street when they come in at the certain distance. They have difficulty for and near distance also. What is the reason for this? Do you know? Just or they may have a different complaints like I can read in the bright sunlight but not in the dim light. My arms are not too long enough to hold the reading material, or my eyes feel strained when I do lot saving work. My eyes are get tired when I read, or the written newspaper is writing font is too small, or I find difficulty to thread the needles. These are the common complaints that patient will brings to you. And sometimes I find it hard to sort out the stones from the rice when I am cooking. The distance looks blurred when I looking up after the I have been reading for a long time. These kind of complaints will bring to the you. Many people comes to you with these kind of symptoms. The Then do you know what is the reason for these kind of complaints? So in our home also we have our parents, those are wearing the spectacle for the near activity, that is what we call presbyopia, means that the inability to focus the near objects. Okay, so this is the condition we are going to discuss today here. So moving towards the main content, the what are the learning objective for this today's session? At the end of this session, you will be able to define the presbyopia and optical conditions. You will be able to describe the causes of presbyopia, and you will be able to narrate the signs, symptoms, and treatment options for the presbyopic condition, and you will be able to differentiate the types of presbyopic spectacles. So moving towards the introduction, we may get many people in the clinic. There are those who report you they have a difficulty in their far and near distance, and they have a difficulty for identifying the persons on the street at some distance, and also they have a difficulty while doing near activity. Threading needle is also difficult for them. These are all comes under the presbyopia. Now, what is presbyopia? Okay, this is the condition where the loss of accommodation of the lens because of the age. So this presbyopia can occur, that loss occurs in the both eyes uniformly, and it affects both eye simultaneously. Presbyopic patients are also known as presbyope. These presbyopic patients will have difficulty in reading books and newspapers. Some may also have difficulty to view far objects also. Now, what changes occurs in the presbyopic age? So, with the in the less or an younger age, the accommodation happens because of the ciliary muscles contraction and relaxations. The lens gets changed its shape. By the age increasing, the lens gets harder, so it will be less flexible. Because of these changes, the lens will not be able to focus so well. So these changes happens in the internal structure of the eye, that is in the crystalline lens. Moving towards the clinical causes of presbyopia. Progressive increase in the size of the lens in the nucleus, and nucleus is smaller at the younger age. When we get older, the cortex become smaller. The capsule loses its elasticity by nature, it loses its accommodation, and weakening of the ciliary muscles. At the aging, the ciliary muscles get enlarged, the space inadequacy occurs, so the ciliary muscles can't accommodate. So these are the clinical causes of presbyopia. Moving towards the symptoms of presbyopia. When symptoms means subject to complaints to the practitioner or an optometrist and ophthalmologist, these patients will complaints to you. They have many complaints like difficulty in the focusing for near objects and difficulty in reading in the dim light, eye strain in the stitching, headache, watering, and tired eyes due to the near work, and difficulty in near reading, that is the small letters font size. So these are the many types of the symptoms that patients will complain to you. Moving towards the presbyopic sign. So holding the things further away from the eye, this is due to the lack of the accommodation of the lens. And at the beginning stage, people started to hold their things further away from the eyes in order to see clearly. As the distance increases from the eye, we need a less accommodation. So also, and they may face the difficulties for the near work. So these are the signs that you can see with the presbyopic patients. Now moving towards the diagnostic procedure for presbyopia. So we have few steps to diagnose the presbyopia. The basic first one is the visual acuity. This test is to assess the level of vision before new glass or a new spectacle prescription given to the patients. And the second one is the refraction, to prescribe the corrective lenses in the spectacle form or an contact lens that you need to finalize by the refraction, and the muscle movement to evaluate the muscles are working together and to in the all directions, and simultaneously slit lamp examination to evaluate the condition of the internal eye also. And then finally to evaluate the condition of the retina and optic nerve, we need to do the retinal examination, whether it is uh, indirect or indirect ophthalmoscopy you can use to assess the retinal examination. So these are the diagnostic procedure we need to follow to identify the presbyopic patients. Moving towards the activity, this is a quick activity. I would request you all please go through this activity, whether it is group based or an individual activity. You can perform activity in group or as an individual also you can perform. Please ensure that all of you get a chance to see variety of case sheets and whether they have taken down the details of the medical records in their handouts or in the case sheets for the future reference. So, whenever you are going through these patients, what you need to assess the patient complaints, visual status of the eye and sign and symptoms of the patients and occupation, what kind of job profile they are going to do or they are doing, and what is their age, okay, and these kind of details has to be recorded on the case sheets, and you please must go through these presbyopic patient case sheet records, so you will better understand. And test undergone by the patient, what are the tests they did? As I mentioned in the earlier slide, that you need to follow the visual acuity recording, refraction, clinical examination and retinal examination. These are the common tests you need to follow, and these are the must for the presbyopic age group patients. And then what are the tests they did for the differential diagnosis purpose, and read and explain the refractive power given to the patient or case sheet. Whatever they are mentioned on the case sheet, you need to read and you explain your friends and seniors or juniors, so that you will get to know that what type of prescription is prescribed for this particular cases. So this activity you can do it with your own hospital or optical store patient database. You can extract and you go through this. Okay, and finally the patient case sheet, what they mentioned and what the communication ends, where the counseling, for example, whether the patient is acquiring the spectacle or in contact lens, whether it is going for the surgical intervention, that also you need to record on their case sheet. And already maybe for this activity, whatever you are getting the case sheet, you will get to know this the advice for that particular patients. Coming to accommodation, the amplitude of accommodation. The presbyopia, it start at the age of 40 to 45 years, because when we get older and the lens in the eye also get older, so that the lens loses its ability to accommodate. Presbyopia begin at the age of 40 to 45 years and slowly getting worse when our age turn to or reaches to 60 years. Now here you can see the table, so you can refer this table, at what distance the power is requirement. Now coming to the correction of presbyopia according to the age. Here I have mentioned that the table, in this table you can see the left side I have mentioned the age groups, and correction required in the diopter pair is in the right side. So at the age of 38 years, that is pre-presbyopia we can call here, they required plus 0.75 diopter at the 38 year, and at the age of 40 they need plus 1 diopter, 45 1.5 diopter. At the age of 50 years they require 2 diopter, and the 55 2.5 diopter. At the age of 60 and above, the people require, the presbyopic members required the plus 3 diopter. So one thing you need to keep in mind, that please note the presbyopic prescription, when you are handing over to the patient, please incorporate the distance prescription and calculate based on their working distance, occupation and the age. You need to consider all these three factors. Coming to the presbyopia glass prescription, spectacle correction is given to the patients, and this is based on their profession. The higher the power correction is given to the patients, those who are doing their very closest near work to the eye, for example tailor, goldsmith, welder, okay. Because of these close work, they requires magnification of the objects, so higher power correction is given to these kind of job profile. Now Moving towards the low power and correction, patient's working distance is long, then the low power correction is required. So the power is less than their actual age power. For example, waiver, computer user or an bank officers, they can use the low power because their working distance is longer than the usual. For patients, those who are more than 60-year-old, they are prescribed with the plus 0.2575 diopter of correction. And coming to the diabetic patients, problems causes early presbyopia due to high sugar and the drug that they intake for their disease or a condition. So lack of adequate glucose supply to the ciliary muscles that causes premature presbyopia. Similarly, in glaucoma patients, due to the pressure in the eye, ciliary muscles cannot shrink. So patient can't read books closely and they need change in their spectacle power very frequently. So these are the things to highlight in this presbyopic correction. So please look into the detailed prescription format and what need to be considered before to hand over the prescription to the patient. Now, what and all options they have in the spectacle? For the beginner, bifocal spectacles glasses are given for the near and distance. Glasses divided into two parts of the top portion that has a power for the distance vision and the bottom part has the power for the near correction. Here you can see in the right side image, top image, that is the bifocal image. And the second one is option is the trifocal or an progressive spectacle where glasses are given for the distance, intermediate as well as the near. And the finally varifocals progressive addition lenses you can prescribe to these patients. The quick activity here, I would request you all please find out few bifocal glasses or an trifocal or an progressive addition lenses and with the different tints also you can find out. This activity can be conducted with the group or an individual level also. So in this you need to focus what type of spectacle they are using, what type of lenses are there in the spectacle, whether it is tinted or non-tinted, and type of the glass which is bifocal or an trifocal, whether it is in progressive addition lenses. So these you can go through an individual level as well as in the group activity. And second one is to the near and distance segment area, whether it is distance is larger than the near or whether it is near one is larger than the distance. Based on their work profile, you can find out the what type of segments are given to the presbyopic patients and the type of spectacle, whether it is bifocal or an progressive addition lenses, that also you can find out on the based on their spectacle assessment. And finally, the image variation is seen through the each type of lens because the bifocal lenses have different image jump action and trifocal have a different, and the progressive addition lenses will give you a distorted image when moving one segment to the another, whether it is distance to intermediate or distance to intermediate and near. So these are the changes you will see on the presbyopic patient's spectacle. So this activity please do conduct with your friends and those who are in the training part on a sales team. So this is an idea to conduct and get to detailed knowledge about the type of lenses, type of spectacle to be given to the presbyopic patients. Some of patients will come to you and they require tinted lenses for their activity with the presbyopic correction. That those kind of lenses also you can find out. Please do remember these following points before going to hand over the prescription for your presbyopic patients. Presbyopic spectacles should not be prescribed mechanically based on their age. It is better to give undercorrect always, especially for the following conditions like some medications taken by the patient can change the refraction. So before you going to hand over the prescription, you need to check and confirm that patient is diabetic or not. If the patient is glaucomatous changes they have and they have medications on, so you need to counsel them for a particular or in frequent changes of the glasses will be seen in future with your this condition. That kind of message you have to give them to the patients. Even similarly, pregnant women also taking medication for the antidepressant or antipsychotics or steroids. For them also you need to consider that frequent change will happen with the medication. Do not prescribe near glasses if the patient does not feel problem while doing near work. So unnecessary, don't overcorrect the patients, those who does not or don't require, they don't need any correction for the near. So don't push them as their age wise prescription don't calculate. Sometimes you may get little late in the presbyopic correction at the age of 40, 41, 42, okay, in some conditions that you need to consider. So as an eye care professionals, what is your role in the presbyopia? So identify the presbyopia, communicate with the presbyopic people and communicate the correct way and prescription methods that patients are going to get from you. After the refraction, double check the result, check the patient's vision and the clear and comfortable, whether they are okay with the your prescription. Okay, clear communication regarding the disease and the treatment opportunities should be well communicated to the patients as well as their parents or an attendants. Patients having defective near vision mentioned here will suffer both physical and psychologically. So it is responsibility of the refractionist to give quality of retinoscopy readings, and you can correct them and objectively and subjectively also. Be patient and careful during finding the reflex, and then things should be considered by eye care professionals before glasses prescribed to the presbyopic age group. Those are age of the patient, occupation and the working distance of that particular candidate. So this is the role of eye care professional in the presbyopic age group, and to identify the presbyopia, communicate with them and prescribe to the that particular candidate. So now moving towards the mind map, what we learn in this presbyopia. So what are we learn, what is the definition of the presbyopia, what are the causes of presbyopia. Here in this condition, weakening of the ciliary muscles occurs and the loss of accommodation will give effect to the near work, and increase in the size of the lens nucleus, that by the age it changes in the nucleus. So these are the causes happens, and the optical conditions that includes the correction where the presbyopic people need the glasses or in contact lens related advice and they acquire that, and sign and symptoms, difficulty in reading, eye strain, watering of the eyes will be there, and the diagnostics test as I mentioned, visual acuity, refraction, slit lamp examination and retinal examination, these we gone through in this session. And finally we have a treatment as an bifocal lenses, trifocal lenses and in multifocal, that is varifocals, for example progressive addition lens. Friends, coming to the end of this my session, I would like to request you all, if you have any question related to this topic, please do not hesitate to write me directly on my email, or you can write on the comment box that I can answer you and I can clear your all doubts. Here I would like to thank you all for your patient listening and going through entire my this session. Here what we brought end of this today's session. Friends, before going to end of my this session, I would like to request you, please like my session and comment whatever you felt during this session, and then share with your friends or family members, those who are interested to learn new topics related to optometry and ophthalmic science. And then finally, don't forget to subscribe. So this is the request to you all. Okay, thank you for your